Hello, welcome back to GERD Awareness Week. This is our conversation about the medications that we can take for reflux and such. My name is Dr. Michael Thorpe. I'm a general surgeon in Muncie, Indiana. So to get started, we're going to talk about Tums. What is Tums? Why do we take Tums, extra strength? All those different wonderful things. Why do we take these medications? And how do they work? When you have reflux, when you have heartburn, that's acid inside your stomach that is going up into your esophagus. Tums are, as it says on the box package, they're calcium carbonate. Calcium carbonate neutralizes acid. It's a direct neutralizer. So if you've got acid present, you eat the Tums, boom, it will neutralize the acid. And that's why you get an immediate relief. Most people, almost everybody gets immediate relief when you take Tums. Some other things that you may have heard of is making baking soda and water. That's sodium bicarbonate. And you drink that down, it's the same thing. It neutralizes the acid, immediate relief. There's certain foods that can neutralize that sensation, some breads, milk, things that make it worse are acidic, vinegar, tomatoes. And a lot of people have specific foods that they avoid because it makes their acid worse. But things that are basic or things that are kind of starchy tend to get rid of the acid sensation, acid burn. And things that are acidic, kind of vinegary, tart, they can increase the acid sensation. So that's kind of the first line therapy that most people take, is just that I've got acid reflux, boom, I'm going to take something. Milk and magnesia is another one. It can help with the milk portion of it, but the magnesium can cause you lose stool, so you got to be careful. Pepto-Bismol is another one. It can help an upset stomach. It helps to soothe the stomach from multiple different angles. So that's a good one as well. But those are all, you kind of take it when you have symptoms. Right as you take it, it helps to soothe your stomach right away. All right. There are other types of things, Rolaids, other medications that are over the counter that you can take that are direct acid reducers, but that we'll just categorize that as direct acid reducers. To understand the medications that you can buy, other medications you can buy over the counter as well as prescription medications, I'm going to pull up this wonderful screen here. Okay. This is an image of, if you would, one of the cells of the stomach wall. This shows you some of the different channels, it's a fun diagram, and we'll use it just to help show where the different medications work. But to orient you to everything here, so it says lumen of the stomach, which means it's just the inside of the stomach. The green is going to represent the area where there's acid in the stomach. The purple here is one of the cells that lines the stomach wall. And then the pink down here is kind of where the other side of the stomach, and that's not the inside. These little shapes right here show a very special arrangement of an enzyme or a special molecule that produces the acid in the stomach. So in the stomach, we have hydrochloric acid. These special little ports here do a special thing where they move, this one right here moves what's called a hydrogen ion or an acid ion into the inside of the stomach. And then it trades it for this called potassium. And it trades it, and so the potassium will come in here and it will, and through that trade, it puts a hydrogen ion out into the gastric juices, and then a chloride comes through here, so you have hydrochloric acid, HCl. Well, how is it that you have the different medications that we take? Um, there's one called an H2 blocker, or an antihistamine of the stomach, essentially. The the H2 blockers we can buy over the counter. They were some of the first ones that we could get uh, in prescription. As in all new medications, we don't want them overused, so we get them as a prescription. And then as the prescription is widely used and people see the side effects and all that sort of thing, then it gets to a point where we can buy it over the counter. And usually the reason why we can buy it over the counter is because something else better comes along, and we have the proton pump inhibitors. But let's talk about the H2 blockers. A couple of those, Zantac, famotidine, ranitidine, cimetidine, all these fun different names. They have Pepsid is one over the counter. So what do they do? How do they work? If you look down at the bottom of the screen, there's a little green pentagon. Now that's not really a pentagon in the cell, but just shows us what's happening. So there's in your body, there's this thing called a histamine. Histamines, you may have heard of the reactions of histamines with like allergies and stuff. But the histamines can signal to this parietal cell, or this purple cell, give them a strong signal and say, hey, we need to make some acid. So the signal comes in here and says, we need some acid here. And it turns this machine on and produces a bunch of acid. Well, if you block that with a medication, then it decreases the signal that to produce acid. Now, as you can notice over here, you've got multiple different molecules that can tell this parietal cell, or this purple cell, to produce acid. So blocking the histamines is good, but you've got a bunch of other molecules that can still send a message to produce acid. So a medicine was produced called the proton pump inhibitor, the PPI. This special enzyme, special machine here, that puts the hydrogen ion into the stomach and trades it for this potassium ion, or the K. The PPI comes in here and blocks this. Boom. It puts a block on there. It doesn't work, and it will not put acid into the stomach insides. And that's how the medication works. So you can have as much of this gastrin, histamine, or acetylcholine as you would like, and still not going to change this. Now, there's a bunch of different types of proton pump inhibitors. I guess the first one I believe that came out was Nexium. Then you've got a host of them. One of them, and they all end with azole. Omeprazole, pantoprazole are some of them, and then you've got a name brand of a very, very strong one called Dexilant, and a variety of other medications that are all proton pump inhibitors. If you don't know what yours is, you can punch the name into Google and it'll tell you. So this is the way that we treat acid reflux with medications. So we have the direct neutralizer of acid with the Tums and milk and bread and other things, Rolaids. We have the H2 blockers, which block the histamines at the bottom of the screen. And then we also have the proton pump inhibitor, which actually blocks this wonderful blue circle here, which is a proton pump, or the H positive, the hydrogen ion, is a, quote, proton. And that goes into chemistry, and there's a little too much to explain right now. but that's just what we call it. It's a proton, and that's what makes it an acid. So this little blue oval here pumps the proton. You put the medicine in here, it stops it from working. There's other side effects that can occur with proton pump inhibitors. Decreased acid. You can have decreased absorption of different vitamins. Um, and if there's any, side effects of the proton pump inhibitors that are listed on the medications. That being said, the proton pump inhibitors are very well tolerated, and there's millions of people that take these medications. They don't always work for everybody. Sometimes the body does a good job at finding another way, a way that we don't recognize, or another way to produce acid. For the most part, though, when patients take this medication, it works really well. When you have to keep on going up on the medications, go from omeprazole to pantoprazole to esomeprazole to, and then you have to bump it up to the strongest one, Dexilant. What's happening there? Well, what could be happening is instead of having like one blue oval here, the body could be producing 2, 3, 4, 5, 6, hundreds, thousands of those, because they're trying to produce the acid for the stomach and they keep on getting blocked. So they start producing more and more and more. And the body can be very good at overcoming medication. So if that's the case, you're having really bad reflux, there may be a reason to look into other means of managing that reflux. Maybe there's other investigations or other procedures that can be done. And on Thursday, Thanksgiving Day, we're going to talk about the procedures that can be done to treat reflux. That's going to end up for today, pretty short, but I hope you guys enjoyed this conversation about how the medicines work and kind of everyday terminology. If you have any questions, feel free to ask in the chat. And per someone's recommendation, feel free to subscribe. And I'll talk to you guys later.